Most important PYQ: Iron Deficiency Anemia versus Thalassemia Trait. Microcytic anemia. This is an important exam trap. Tricky PYQ. Why this PYQ is important? Because it appeared in AIIMS 2023, PGI 2022, other state exams. So this is a must-know high-yield topic. Hey everyone, did you know that almost 70% of pathology questions repeat every year in MBBS exams? Today, we are going to solve a super important PYQ that can help you score easy marks in just 5 minutes. Now, can you tell me the difference between IDA, Iron Deficiency Anemia, and Thalassemia Trait just by looking at the peripheral blood picture? Don't worry, by the end of this video, you will never get confused again. Now first, let us focus on what the examiners always check. Both are microcytic anemias. So you should take care of the 4 key parameters. First is hemoglobin, second is MCV, mean corpuscular volume, third is RBC count, and fourth is the PBF findings. If you remember these 4 points, half of your question is already solved. Now, let's take a quick look at this comparison table. In iron deficiency anemia, hemoglobin is low, whereas in thalassemia trait it is mildly low. MCV is low in IDA, that is microcytic, but it is very microcytic, very low in thalassemia trait. RBC count is low or normal in iron deficiency anemia, whereas it is high or normal in thalassemia trait. Peripheral smear shows microcytic hypochromic red cells in IDA, and there is an isopoikilocytosis, that is variation in size and shape of the red cells. But the PVF picture of thalassemia trait is different. You can see target cells, microcytosis, basophilic stippling. One important parameter is the serum ferritin. This is low in IDA and normal in thalassemia trait. Now, let's compare iron deficiency anemia versus thalassemia trait. Now, keeping the table in mind, just remember in iron deficiency anemia, hemoglobin is low and cells are pale and fewer. In thalassemia trait, hemoglobin is mildly low, but RBC count is high and target cells are seen on the smear. But the important parameter is serum ferritin. This is the exam key. So, what is the common exam trap? The tricky points. Remember, both the conditions are microcytic. So, do not rely on MCV alone. Always check RBC count and the peripheral smear. And remember, serum ferritin helps you avoid traps and get full marks. So now, a quick memory trick. I will give you an important mnemonic. So, IDA is few and pale, meaning low RBC and pale cells. Thalassemia trait, many and small plus target cells, meaning high RBC for many, very small cells, sometimes with target cells. Repeat this mentally before your exams. It will stay in your memory for long. Now, real PYQ example. In AIIMS 2023, the question was, a case was given having hemoglobin 8 gram per deciliter, MCV was 65, and RBC count was 5.2 million. So just think what this condition could be. I already told you that RBC will be high. That means it is thalassemia trait. Easy and full marks if you follow the table and the mnemonic. Now, if this trick helped you, hit the like, share and subscribe button. Comment your most confusing PYQ and subscribe for more 5-minute high-yield pathology videos by Dr. XYZ Pathology Pulse. Remember, just 2 minutes of smart revision can save marks in exams. Happy studying. Take good care of yourself.